It's a pleasure to be here today to talk about climate change and to kick off this day of discussions and presentations on global health in a changing environment. And I mean, what other way to start than to talk about climate change, which certainly impacts the environment in so many different ways. So climate change is obviously a very hot topic in the news, and we're only seeing increased coverage of it. Even during the pandemic, climate change has been a hot topic. So I looked just overnight to see what has been popping up, and we see lots of different climate change topics, from articles on tips on how to fight climate change with your garden. A really interesting story that I'm excited to read later today was just in the BBC about the science briefing that convinced Boris Johnson about climate change. Apparently it was 11 slides, and these 11 slides convinced him to take action on climate change. So I'm excited to check that out. There's been increasing coverage of climate change impacts on mental health. A really interesting study that actually came from Canada has been getting a lot of news coverage this week, which was a project that looked at how to visualize what climate change will look like in the future in the prairies. And over the past couple of weeks, a lot of increasing coverage on natural gas stoves and how that contributes to climate change and how it also can actually be harmful for human health. So we see, this is just like a snapshot of some of the headlines that caught my interest this morning and I've been paying attention to this week. But you might be wondering, how is the climate changing? We know that it's getting warmer, but what are the most recent research results related to this? Well, this past summer, the IPCC Working Group 1, which studies the physical basis of climate change, released their most recent report in August. And the last report that Working Group 1 released on the physical basis was from 2013. So this was a pretty exciting report in the climate change world. And I just wanted to go over some of their key findings. So the first finding is a pretty consistent message that we've heard from the IPCC over and over again. And that's that the warming is caused by humans. So they have more data and more evidence to support this idea that if climate change, if the climate were not influenced by humans, we'd see this bottom green bar, and that's what our climate would look like. But when you start to add anthropogenic causes of climate change, you can see that the observed trends in temperature over time actually match the modeled anthropogenic causes of climate change much more closely. So there's just further evidence that the warming is indeed caused by humans. The other key message coming from this report was that every increment of global warming increases regional level warming. So that the warming around the world impacts us at a local level, and it changes the atmospheric temperature where we live, but also precipitation and soil moisture change. So if you look at these, classic style IPCC graphs here, we have 1.5 degree warming projections in this first column of globes. You can see that it gets worse with 2 degrees warming, and then 4 degrees global warming, even more so. And this has been a major shift from the last IPCC Working Group 1 report, where they were talking about different RCPs. Instead, now what they're talking about is degrees warming, because the Paris Agreement talks about the importance of limiting our warming to 1.5 degrees and certainly no more than 2 degrees. So the IPCC has shifted their focus in how they talk about climate change to degrees warming now. Another key finding, and this was a pretty exciting one, was about the increased frequency of extreme events and that specific attribution to climate change. So we always knew that climate change is bringing more extreme events, but the science has really advanced in the past decade, and now it's very, very clear what we're expecting to see. So if you look at this figure from the report, you can see that historically we would expect some extreme events, in this case extreme hot temperatures, certain types of events to happen once every 10 years or once every 50 years. And this type of language is actually really important in things like building codes. You might have heard of things like 1 in a 50-year flood or 1 in a 100-year flood. And a lot of like building codes and engineering decisions are actually made around these types of statistics. And so with at present, with 1 degree of warming, things that used to happen only once every 10 years or once every 50 years are happening now, like 2 or 3 times. And as we, see more warming, we're expecting that to see more and more. And at 4 degrees of global warming, we can see that an event that used to happen once every 10 years is projected to happen once every single year. In the first panel. And the second panel, an event that happened only once every 50 years is now projected to happen once 40 times in 50 years. So that's essentially once a year. So things that used to happen only once every 10 years or once every 50 years are projected to essentially happen once a year if we hit 4 degrees of global warming. The fourth main innovation of this report that came out is that they started to consider development pathways in their modeling. So a lot of past climate change projections really focused on emissions pathways, but in this report, they have very clearly integrated different development pathways into their climate change modeling, what they call shared socioeconomic pathways. So in the graph here, we have the top ones: temperature, Arctic sea ice, and sea level rise. And it's still the classic IPCC models where we see what's happened, what we've observed to date, and then these different projections into the future. And again, it shows this, the span or the different range of possible futures that we could see with different emissions, but that's also tied now into things like population growth, development patterns, access to resources, access to social services. All of these things are now actually considered right into these climate change projections, which has been apparently helpful for decision makers in terms of thinking about what not only climate change future do they want to see moving forward, but it integrates all these other things into their modeling as well. So then that raises the question of, okay, so the climate is warming, we're seeing more extreme events. This is a question I want to pose to the audience, and that's, how does climate change impact you? So if you think about all the things that I just mentioned, and if you think about the topic of today at the conference, I'd like you to reflect on how these things impact you. So I'd like to pull out Menti. So if you have a smartphone, you can use the QR code on the screen to pull this up. If you don't have a smartphone, you can just pop open a browser in the internet and go to www.menti.com. And the participant code is up there. I'll read it out loud. It's 63826086. And the question is, how does climate change impact you? So if you start to fill that out, hopefully this will start to populate. Again, it's menti.com and the code is at the top. It's 63826086. And we can see some answers pop in. How does it impact you? Freezing. Okay, interesting. Extreme temperatures. We certainly saw that this past summer with the heat dome. So we have wildfires, short winter seasons. Wildfires has certainly impacted Alberta. The flooding, especially what we've seen recently in BC, these atmospheric rivers that have been happening, rising energy costs, wildfires causing respiratory challenges, water shortages, changes in infectious disease geography, forest burning, smoke and not being able to go outside, some mental health impacts here, including anxiety. People think of polar bears. That's definitely become an icon of climate change. Insurance costs. Yes, the insurance industry is definitely interested in climate change. In fact, the organization that sort of doesn't govern but guides the insurance industry in Canada, apparently their top 2 concerns right now are earthquakes in the West Coast and climate change writ large for Canada. So that's definitely a real concern. Heat, yes, especially in the summer, especially when you have lots of people and animals inside your house. Mental health, smoke, icy conditions from freeze thaw, yes, makes it hard to go outside and cycle. Social determinants of health are critical too. Some of the things that things like heat stroke and cardiovascular disease are definitely some concerns. bacterial overgrowth in oceans that has really important environmental implications, but also food safety implications as well. So yeah, climate change is already impacting us in all these different ways. Let's see if we can go to the next slide. There we go. So there's lots of different ways that climate change impacts each and every one of us. There are 4 things actually that were already brought up in the last slide. So I just wanted to highlight some of those: the impacts of heat waves on us, forest fires, food safety, but also food security. So the type of food that we have available in the grocery store is impacted by climate change, and mental health. And I'd just like to focus on heat waves for the next couple of minutes, because this is something that we just recently experienced this past summer. The heat dome was a huge climate change event, really. It really showed us, we knew that climate change was going to increase heat waves and extreme heat events. But what we hadn't experienced yet, at least not in North America, was the increase in intensity that we could actually expect to see in the future. So we've had heat waves before, we've broken heat temperatures before and heat records, but the magnitude of increase that we saw this past summer was absolutely unprecedented in North America. We had never seen anything like it before, and it definitely gave us a taste of what could be in our future with climate change. In British Columbia alone, there were almost 600 deaths and over 300 deaths on a single day in June alone. But there wasn't just deaths or some of the things that you often think about when you think about heat waves, like heat stress or exacerbating existing conditions, respiratory issues or things like that. It also impacts mental health. And there was a study that came out just in the past month that was a cross-sectional survey conducted multiple times over time. So they followed a cohort of people. And they found that after the heat wave, that reported climate change anxiety levels increased by 13% after the heat wave. And about 40% of participants reported that they were much more worried about climate change after the heat dome than beforehand. So, and there's also been a lot of studies, especially in the United States, that show that during heat waves, the hospital admissions for mental health reasons increase. So heat waves and heat effects impact us in a lot of different ways, and research is really starting to grow and expand and look at the different ways that heat impacts all of us. There's also a lot of research looking at, so what can be done? So if we're expecting to see more heat waves into the future, how can we prepare for that, and how can we protect and promote health? Well, heat plans is something that we often, it's a go-to response for heat waves. Most cities have a pretty solid heat plan so that when the temperature hits a certain threshold, that certain resources are mobilized. And a critical part of most heat plans is an early warning system. So if there's a projected heat wave coming, getting the word out and letting people know. And this has become like a cornerstone of heat plans. But the question that a lot of people are asking is, how effective are they? Are they going to be able to actually protect human health, especially in the context of climate change? And how effective in particular are these early warning systems? Do they actually protect human health? Well, there was a major study in the United States that came out just this past summer that found that heat warning systems are actually not associated with a lower risk of mortality, but they are associated with increased risk of hospitalization. So, maybe people are aware of it and they're going in and seeking help more when they need it, but it's not actually reducing heat-related mortality. And that's probably for a lot of different reasons, but one is that context matters. So thresholds really need to vary by location, and more research needs to be done to inform that work. So a lot of times different cities, they'll use a threshold that's used in other places, but the climate of that city might be different. The types of people and the demographics who live in that city might be different. So that local context matters and needs to be better integrated into these early warning systems. And also that just keeping in mind that early warning systems are only a component of heat plans. And so one part of the heat plan in the early warning system is to get the word out when we're expecting to see a heat wave, but that also has to be paired with mobilizing different resources to help people actually cope with the heat wave itself. And also reaching critical populations who might not have access to green spaces or cooling stations and so on. So a lot of research has started asking this question. So, we know that climate change impacts health. So what can we do about it? What public health measures are actually effective at reducing mortality and morbidity in these situations? And this is important because we know that heat waves have increased. We've observed this over the past couple of decades. We've seen a significant increase in the number of heat waves that have happened. We know that these heat waves have directly impacted health. And we also have projections looking forward that show that this is going to continue to happen more so. So just one example that I wanted to show you in this graph here shows that under a lower emissions scenario by the end of about 2040, we would definitely see an increase in these extreme heat wave events. But under a high emissions scenario, we'd see about double of those happen. But if you look towards mid-century, we can see that under a low emissions scenario, we still see an increase in heat wave events, but we see more than double under a higher emissions scenario. And by the end of the century, this gap is enormous. So we still see an increase in the number of extreme heat wave events that we'd expect to see, but under a high emissions scenario, it's just through the roof. And so that difference between a high emission scenario and a low emission scenario by the end of the century becomes quite dramatic. And so this research question of what works best to protect human health becomes a really important question to answer. And it also begs the question, so that was an example for heat waves, but what else don't we know about climate change and health? So in our research group, this is one question that we had asked last year, and we did a really large systematic scoping review using systematic methods to answer this question, just to get a sense of what's happening in terms of research, specifically in North America. And so we looked at all sorts of different climate change variables and climate change hazards. We considered a lot of different social variables to look at the social determinants of health in the context of climate change and all sorts of different health outcomes. And one of our main findings was that we know the least about climate change in the regions that are experiencing the biggest climate change impacts. So on this map, you can see very clearly that there's hardly any published research coming from Mexico. The United States, there's been a lot coming from the United States and a little bit less in Canada. And then even if you look within those countries, the regions that are experiencing the most devastating climate change impacts, we actually know the least about. So in Canada, a good example is the Arctic. The Arctic is experiencing the fastest, most dramatic warming on the planet already, and it has the least amount of climate change and health research happening. The second major finding is that there are critical knowledge gaps. So while there's been a lot of research looking at heat morbidity and mortality, there's been a lot less research looking at other health outcomes. So things like mental health, there's less research done on the impacts on injuries from extreme events, foodborne disease, there's not very much research done on. So there's a lot of content gaps that exist right now in North America in terms of climate change and health. And the other gap is looking at what type of research questions are being asked. So most of the research looks at how climate change has already impacted or will impact human health, but much less research focuses on how like the mitigation piece of this and how reducing emissions can also benefit health, and even less looks at climate change adaptation. So what adaptation strategies will be most effective to reduce climate change impacts on health. And in Canada in particular, we observed a really concerning trend where we actually saw a decreasing amount of research over time looking at adaptation studies and looking at how we can minimize the impacts that climate change has on health and into the future. So there's massive amounts of literature. I mean, if you include the literature reviews that were included in that, and also commentaries and other things, there were over 1,000 articles published on this topic just since the last IPCC report in 2013. So a massive amount of literature. And how is that synthesized, and especially for policymakers? Well, one of the main ways that that's done is through the IPCC, the Intergovernmental Panel on Climate Change, which is a UN organization. And so one of their special reports, which is a smaller report, was published in 2019, and it looked specifically at the ocean and cryosphere in a changing climate. And this is a really rigorous process. Basically, each country nominates authors to the IPCC. The IPCC selects different scientists and specialists in a broad range of disciplines and with different expertise. They go through and they synthesize the literature. It's an iterative process, and the report's actually peer reviewed 3 times, and it's open for anyone to peer review it. And that includes scientists from around the world, but also different governments. A summary for policymakers is prepared, so that's a summary of the report. And the summary for policymakers is actually reviewed and approved line by line in a plenary session by UN member states. So here in this picture, you can see in the screen on the left, the green highlighted text has been approved and accepted by the UN member states. The yellow line is under consideration and discussion, and the unhighlighted line hasn't been discussed yet. And on the other side, on the right-hand side of the screen, you can see the revisions that were made as you go through this line-by-line approval process based on questions that member states have or negotiations on how the text is worded. And that actually matters because these reports have implications for decision-making, which I'll discuss in a minute. So in this SREC report, the Special Report on Oceans and Changing Cryosphere, we assessed almost 7,000 articles. There were over 100 different authors from around the world with expertise ranging from, climate change, like ocean chemistry and pH expertise, to anthropologists, to economists, all like a huge range of disciplines, but all people who focus their research through the lens of climate change. The authors were from over 36 countries. Almost a third of the authors were women. And we had over 30,000 reviewer comments that we had to address as we went through those 3 rounds of peer review. And so I had an example here, but I'm actually going to skip through it just to make sure that we can get to the policy piece of this today. So the question then becomes, how did those IPCC reports, which are a huge investment from governments and from researchers, how does that actually impact international policy arenas? Well, these IPCC reports actually underpin the climate change negotiations that happen each year at COP. So these UN COPs happen every year, and these are where major climate change negotiations and agreements are struck. So things like the Kyoto Protocol was established and agreed on at a COP. The Paris Agreement was established and agreed on at a COP. And now, since the Paris Agreement, each COP has actually focused on how to implement the agreements that were made in Paris about 5 years ago. So at COP26, this was a really exciting COP because it was the first COP where there was a health pavilion. So this meant that for the first time, decision makers had health on their radar when they were talking about climate change and doing their climate change negotiations. And I had mentioned before that the IPCC reports underpin these climate change negotiations. And so the different UN member states go into the COPs having agreed to the science that has been reported in the IPCC reports. So when we're going through the summary for policymakers and approving the summary for policymakers line by line and going through those negotiations, there's actually pretty high stakes for governments who are involved. And certain countries, especially oil producing countries, will bring teams of lawyers to help in the negotiations, because every single word matters, and how the sentence is phrased actually has a lot of impact, potential impact for these countries. And what I've actually seen in some preliminary presentations that we had to give for the upcoming IPCC report that's about to be released February 28th, so stay tuned for that, is that countries have also started hiring their own climate modelers to further challenge the science in the IPCC reports. So I guess what I'm trying to say is that the IPCC reports really matter, and they are high stakes for countries because they basically said, we agree to the science that are in these IPCC reports, and the negotiations that we'll have at these annual COPs will be underpinned by this science. So the stakes are high, and these IPCC reports matter. So they're not only reports that are helpful for scientists and helpful in teaching and helpful for us to understand the state of science, they actually underpin international decision-making. And this year at COP, like I said, it was very exciting because health was on the radar. It was on the program. There was a whole health program that was involved at COP. So there were lots of different presentations where health was the focus of the presentation. So it was a way to bring health into this international policy decision-making arena in a way that wasn't possible in the past. And of course, there's civil society protests at COP, and the protests are all about bringing, trying to hold decision makers accountable to climate change and encouraging them to make, ambitious agreements and decisions around it. And this past year was also really cool because a lot of the civil protests that were happening at COP had a climate change angle, as you can see in these photos. So when we're talking about moving research into international policy, the research happens, the IPCC does the assessments. Those assessments are supposed to underpin the negotiations at COP. All the countries have agreed to the science in those reports. And then the question becomes, what action will come from that? And that's the thing that I think that a lot of people are paying attention to right now and wondering about. And I guess we'll see what happens over the next year and what COP27 looks like in Africa next November. So with that, I'll end my presentation, and I think there might be a couple minutes for questions. Thanks so much.